Good day, I am Fercarlo Pascual of PSN3F, and today I'll be teaching a client on how to use an incentive spirometer. For the goal is that the patient will accurately demonstrate the procedure for using the spirometer. And for the equipment, check for incentive spirometer. For the implementation, review chart for any health problems that would affect the patient's oxygenation status. Next is to bring necessary equipment to the bedside stand or over bed table. Next is perform hand hygiene and put on PPE indicated. Next is to identify the patient and close the curtains around the bed and close the door to the room if possible. Explain what you are going to do and why you are going to do it to the patient. Next is to assist the patient to an upright or semi-Fowler's position if possible. Remove dentures if they fit poorly and assess the patient's level of pain. Administer pain medications as prescribed if needed. Next is to demonstrate how to steady the device with one hand and hold the mouthpiece with the other hand. If the patient cannot use hands, assist the patient with the incentive spirometer. Next is to instruct the patient to exhale normally and then place the lips securely around the mouthpiece. Then instruct the client or the patient to inhale slowly as deeply as possible through the mouthpiece without using the nose. If desired, a nose clip may be used. When the patient cannot inhale anymore, the patient should hold his or her breath and count to 3 and check for the position of gauge to determine the progress and level attained. If the patient begins to cough, splint an abdominal or chest incision. Instruct the patient to remove lips from mouthpiece and exhale normally. If patient becomes lightheaded during the process, tell him or her to stop and take few normal breaths before resuming incentive spirometry. Next is to encourage the patient to perform incentive spirometry 5 to 10 times every 1 to 2 hours if possible. Next is clean the mouthpiece with water and let it dry, and remove the PPEs if used, and perform hand hygiene and document. Okay, this is an incentive spirometer. This is the handle. These are the indicators of how many liters of oxygen you breathe in. This this is the indicator if you're breathing too low or if you're breathing too slow or you're breathing too fast. This little blue one in the middle should stay here to attain a better breathing pattern. And this is the mouthpiece. It can be extended like so, and it can be put back. And this is the base. You can put it on a flat surface, or you could just hold it like this. Okay. The blue one inside is called the piston. It rises whenever you inhale air, and as you can see, the numbers here are the indicators. You can tell easily where or how much air you have inhaled. That will be all. Now, remove your accessories and perform the hand hygiene. Good day, sir. I am Fernando Pascuala, based in 3F, and today I'll be teaching you on how to use an incentive spirometer. Using the incentive spirometer, you will be exercising your lungs. It means that it will give your lungs an exercise. It will expand more whenever you breathe.